Hi, everyone. We are going to be covering a soap note today with a hypothetical client named Veronica who's extremely stressed at work and experiencing some pain. Now, we are going to go MBLEX style. A lot of these answers are going to make sense to you. All three of them in the multiple choice may technically be correct, but we're going to choose the best answer out of all of them for the questions. All right. Just as a quick recap, S in SOAP is for subjective information. This is things that the client reports to you in the intake, in their interview, that they point to on their body, that they describe to you. If it is coming from the client themselves, this means it goes in the subjective information. Objective data is based on your inspection, your palpation, and your testing, and a record of any interventions that are performed in the massage and what effect you saw them have. All right. A for analysis and assessment. Usually we just say assessment of the subject and objective data for the effectiveness of the intervention, the methods used, the actions taken during the session. Did you observe limited range of motion during the treatment? What areas are tender to touch? What did you assess and what did you find out in this assessment? P is for plan. This includes the methodology to be used in future interventions. So, what are you going to do in future massage sessions? What are you telling them to do at home for homework? Now, remember, you cannot prescribe anything and you cannot tell them to do something directly. You cannot say, start doing sit ups, start drinking water. You can suggest, you can say, you may want to consider, or my advice, or what worked for me was to, or what worked for other clients that they found successful was to do this instead of this. Please be very vague, be generalized, give them a self-care plan, but do not tell them that they quote unquote have to do it, because that does look like you are prescribing an exercise which is out of your scope of practice. All right. We are going to be using this soap note. I have provided a ton of soap notes and other samples for you to use in your bonus resources this week. This is the one that I generally use if I want something easy and prescriptive to write on. It might look a little bit confusing there with massage media. When we think of media, normally we think of like news media or social media because of today's vernacular. Media is plural for medium. This is anything that you are using in the massage atmosphere to treat this client, whether it's shea butter, oils, lotions, a particular kind of music, a particular kind of aromatherapy scent, things of that nature. Anything that you are altering within your scene or doing for this particular client, especially with what you are putting topically on their body. If you're using a salt scrub, if you're using any kind of mud, lotion, oil, that type of stuff goes there. All right, this one's pretty cool. It is included in your sheets, in your bonus resources as well, if you want to print and keep this one. Now, this is the scenario here. So we're going to talk about it. All right. Veronica comes into the office holding a heavy purse the size of a gym bag over her right shoulder. She reveals she enjoys jogging after work and carries her gym bag with a change of clothes, gym shoes, hairspray, makeup, laptop, and several other items in her bag everywhere. She is dressed in a very form-fitting business skirt suit and extremely tall high heels. You notice her ankles are swelling over the sides of her shoes and the tops of her feet look fluffy and come over the shoe a little bit, all right? Like a little can of biscuits popping open. She complains that her left side hurts and points to her obliques. She says that her legs swell a lot and her lower arms and hands feel like they go numb. Now, I'm going to stop you here. Now, your obliques area is also your flank area where the kidneys are, and kidney trouble could mean edema in the legs. For this client, let's assume she does not have a kidney problem, so there's no contraindication. She also has pain in the left side of her neck. She finds her job very stressful and has to stand to give presentations in different offices in her building most of the day, carrying her bag from room to room, traveling all over the large building complex. She states that she constantly feels overheated and prefers cold, dark places to relax. She does not like spa music. She breaks out in acne with most massage oils. She is allergic to arnica but loves lavender. All right, so let's talk about this. Her neck pain is worse after working all day, but she feels better after sleeping on her left side with two pillows. Her left side aches dully most of the time and is worse after her second office trip of the day, but is better after a warm bath at night. Her legs begin swelling after her first office run and stay swollen until she wakes up in the morning. She wants her legs to stop swelling. Assume this is not a medical condition again, no kidney issue, and her left side and neck to hurt less on a daily basis. All right, you're going to want to go above and beyond with the intake questions to gain more insight into her chief complaints. Like, can you show me how you hold your bag during the day? She's already described it. You saw her walk in with it. Do you lean a particular way when you walk or sit at the desk or sit in the car? I've had a lot of clients in the past in the office who have had unilateral pain because they liked to lean and put their elbow on the console in the middle of their car, or they like to lean out the driver's side window and drive with the window open and put their arm on that window frame and lean to the left. And in both cases, they had unilateral pain that was ipsilateral to the side that they were leaning. All right. Remember, unilateral means one side, ipsilateral means the same side. Okay. So you could say if she has pain on her left side and she's leaning out her driver's side window all the time, her pain is ipsilateral to the direction that she's constantly leaning. All right. When do you feel overheated? Let's find out when she feels hot. Are you on any medications to deal with this situation or issue specifically? You need to know if she's taking like ibuprofen, NSAIDs, muscle relaxers, aspirin, especially anything like that before she's getting a massage that might either alter how the tissue feels when you massage it, alters her perception of pain when you massage it, or could potentially cause bruising. All right. What do you do at night that reduces your leg swelling? All right. If she tells you she's putting it up on a high bolster, that's what you're going to do in the massage. When you feel yourself becoming stressed when people are talking, do you clench your jaws or feel tension in your back or shoulders? Now, notice, although we're asking about the stress and people talking, we don't care about that in the SOAP notes. We're not talking about that she's stressed at work. That's not part of our answers. What is part of it is when you clench your jaws, or do you feel tension in your back and shoulders? We're trying to find out where she feels it in the body specifically. You do not want to notate anything about her work. You just want to notate body feelings and body issues, okay? What lotions do not cause a reaction for you that are safe for you to use in massage? This is important. She says she breaks out with oils. Well, are there lotions that she also breaks out with? You need to find this out before putting anything on her body. Are you doing anything else to ease the pain or swelling? If she uses ice packs at home, let's do ice massage and make it phenomenal for her. All right. She did state that she feels overheated and prefers cold, dark places to relax. She does not like spa music. So you need to find out what she does like. She doesn't like spa music because of the tinkling piano. So you ask further, what kind of music do you like? Well, we already know that she doesn't like talking. Okay, so maybe not something with a lot of lyrics. But if she doesn't like high tinkling noises, she does reveal that she likes deep ambient sounds or sounds of like deep bass or cello, things of that nature being played because they're very low, monotone sounds that are very soothing for her. All right. Allergic to arnica, something to keep in mind. Arnica can cause heart palpitations and other issues in a lot of people. All right. This is a really super common massage cream ingredient, especially in like the biotone heavy stuff and deep healing ones, because it is phenomenal for bruising and for skin irritations, but it does cause cardiac problems in some people. So you need to watch out when she tells you this, that it is not an ingredient in your common massage lotions. She can't have oil, so you're going to lotion. It better not have arnica. All right. Some things to pay attention to, just food for thought for your brain going forward into the field. She has extremely tall high heels. The lower leg and the movement of the calf are the lymphatic pump for the lower body. Wearing high heels that do not allow for the pumping action of the calf muscles or proper circulation are a huge cause for concern and probably why she's swelling if it's not a kidney fluid issue. All right. Her left side hurts. She pointed to her obliques. Wearing a heavy bag on the right side means that the stabilizing muscles on the left side of the body will be fighting that imbalance, right? She's being pulled to the right. So now her obliques and her core muscles are constantly trying to, pull her back into homeostasis, back into normal posture to the left, right? They're trying to keep her upright. So trying to return the body to a proper posture is going to cause increased tonicity on that left side, causing tightness and pain. All right. It's going to lead to lactic acid buildup and general fatigue as well as that pain. She has pain in the left side of the neck. The neck is also going to be fighting that drag of the heavy bag, especially since it's pulling in on those upper traps and pulling you down on the right. She is struggling to pull her head constantly upright to the left. All right, these are all things to keep in mind as you are reading through this above and beyond just the, hi, how are you? Oh, okay, you've got left-sided pain. Let's pay attention to that. You need to sort of pay attention to their posture, what they're wearing, what they tell you. What is the body doing to alleviate the issues that they're having that is now causing issues on the other side of the body as well? Please pay special attention to their preferences. Not only does it make a massive difference if they're allergic to it, but if you notate the things that they like, the next time that she comes back in, if you remember to use lavender lotion because she can't have oil and she loves lavender, and you've already got some deep ambient music on for her because she dislikes those tinkling high noises or spa, she's probably going to come back to you again and again, believing that you're a miracle worker because you've remembered all this personal information about her. All right, good luck, guys, with filling out the soap note, and feel free to download it for future use if you happen to like this copy.